So, but let's get back to the procedure, because
Yes.
I really see that there's, I mean, that must be very artistic for you to do, right?
Yes.
So, and it cannot be just kind of just painting a big eyebrow on there. You made already
No.
reference to the fact that you almost like have like strokes and hair strokes that imitate the appearance of true eyebrow hair. But how about the color?
Yeah.
Is it all black or what you're using?
Oh,
or?
no, no, no. I mean, we have blondes, brunettes, redheads. I mean, all the color array that you can have. The clients come to us with all kinds of requests, and we match it to you, the color that you want, basically. Also, shape-wise, people are nervous because if you've drawn on your eyebrows for 20 years and you're used to this certain shape, who am I to come now and tell you, well, this is how you have to do it? I might make suggestions. I might say to you, you know what, one eyebrow is a little higher than the other, let's adjust that a bit. But for the most part, people know what they're doing. If they've been doing it for decades, they do a pretty good job themselves. And if they don't know what they're doing, then I basically say, I go with their anatomy. Obviously, the brow bone gives me a good guide for that. And certain pointers that all makeup artists will use, I do that. And color really is, if there's no hair on the eyebrows, we basically just go by the hair color that they have. And if they do still have hair remaining, then we go with the hair that's on the eyebrow, so it matches perfectly. And eyeliner is just something that people usually want to have something neutral. They might go with a slate or a brown, or some people will even go with black. I mean, it really depends on how you wear your makeup and what you want to do. And the beauty about the yearly touch-up is that you can alter that color a bit. Every year you come, you might say this year, you know what, I want to have like a moss green instead of the blue that I did last year. So we'll adjust that a bit. That's very flexible because of the fading process. You can adjust that a bit.
Now, Julia, when somebody, let's say, came the third time to you for a touch-up and says, Julia, I really like you, you do a fine job, but can we make it a little bit more permanent? Can you go a little bit deeper? Do you do this at all?
No, I don't. And then I would probably not be the correct technician at that point. I would probably refer out to somebody that could do that more permanently. I find, again, for the most part, the demographics that I have, most women that come to me are working women, and they are in the field, and they do want that flexibility because trends come and trends change, and some years we'll have wider eyebrows are in, and then some years thinner eyebrows are in, and people don't necessarily want that permanency on the face. On the body it's different, you can cover it up, but on the face it's nice to have that option to change it up a bit if you wanted to.
Do you mind giving our viewers a little bit of an idea about how much they're up for a set of eyebrows? How
the
much,
pricing?
Yeah, roughly. How much is it running at?
There really is no range per se. It's $550 for the brows, and $350 for either upper or lower eyeliners, and $550 for the lip liner. I do a procedure called full lip color, which is usually done in 2 sessions. You do the liner first, and then I go back in and fill the color, and that's $1,000 altogether. And then, of course, all my camouflage work that I do, say I have to match skin color to a scar, I would charge by the hour. That's $500 the hour.
Yeah. Well, it's I mean, if we think about how much time most women spend in order to get ready, and
for the makeup alone.
Right. That's also.
But they spend for the makeup. Right? Yeah, we've actually calculated out the boosts are pretty affordable. So the yearly boost, if you come back to me within 12 to 18 months, it's $100 per procedure, and you spend way more than that on cosmetics a year.
Seems very, very affordable.
It's very affordable after that. Yes, they'll never pay that much again if they keep up with the boosts.
Well, let me ask you. You must have some pretty interesting requests about what people may may consider cosmetic makeup or tattooing. Can you share some of the?
Yeah, I can. For example, I had some gentlemen now come forward and wanting in the 80s and early 90s, I think they were really still experimenting with the hair plugs.
Yeah.
And I don't know why they did that, but they used to just leave this big scar in the back. They wouldn't sew it back together, so they had like about a half an inch, basically, which is a lot of space where there's just a big fat scar. And so if they wear their hair long, it's fine, but if they wear the hair short, the scar shows. So I've had requests where I had to go in and tattoo that, or receding hairline. I've done tattooing, and then I do, you know, just tiny little dots, so it mimics follicles. I've had.
How about beauty molds? Anybody ever ask for beauty molds,
beauty marks. I have a couple of those. Yeah. So yeah, every now and then I'll have that. But also from residual scars from like plastic surgery, I will do, you know, right here sometimes. Or I've done port wine staining as well. So I mean, I could go on and on and on, I guess, but...
and then in the medical field, you mentioned to me, I mean, really a big part of your practice is basically areola and nipple reconstruction and tattooing for patients who underwent breast surgery for breast cancer most of the time.
Exactly. And I'm kind of like basically the cherry on top, I like to call it, because they've already gone through so much turmoil by the time they come to me, and they're in a better place now, and that's kind of like the last thing. And the plastic surgeons usually do a great job in physically reconstructing them, and making it three-dimensional, but of course the pigment is missing. And some plastic surgeons will actually go in and tattoo the nipple areola for them, the color, I mean, but some won't. So that's when they come see me and get that done, so they can just move on with their life and, you know, go about what they want to do. And those are also the ladies that have lost their eyebrows, maybe to chemotherapy, or the lashes, you know, they don't have that lash line anymore, so.
And the areola, is that also a semi-permanent procedure?
It's a semi-permanent, yes. I will see them every year, for their yearly boost. Okay. You know, I tell them to see me like they're going to their physical. Just put me in the calendar, you know, see Julia once a year for that boost.
Well, very good. For people who are interested in maybe touching base with you, you have a website.
It's pigmentausa.com.
Pigmentausa.com.
Yeah, and they can also Google me, Julia Bowers. Yeah. If they put in Julia Bowers permanent makeup or Julia Bowers cosmetic tattooing, I should come right up.
You will come up on Google there.
Yes, I will.
Well, that's very good. Thank you very much, Julia, for coming in and sharing with our viewers what you're doing about cosmetic tattooing and permanent makeup.
Yeah, thanks for having me.
You're very welcome.